Hello everyone, this video will talk about cerebral palsy. What is cerebral palsy? It is a permanent physical disability that affects muscle or motor control of the body. Cerebral refers to the brain, while palsy means a complete or partial loss of the ability to move part of the body. It is due to faulty development of the brain and in most cases is present from birth, although often not recognized until later in infancy or childhood, but is usually apparent before the age of 2 years. Cerebral palsy is not a hereditary condition, that is important to note, and it is also not a diagnosis or a single condition, but it's rather a general term to describe a group of conditions that cause movement and posture problems. So the incidence of CP is about, or cerebral palsy is about 1 in 500 live births, and is higher in males than in females. There are 4 main types of CP or cerebral palsy based on the type of motor disturbance. The first one being the spastic cerebral palsy, which is the most common type. Spasticity means stiffness or tightness of muscles, which is most obvious when the person tries to move. The second type is the athetoid cerebral palsy. Athetosis means uncontrolled movements, which often lead to erratic movements. The third type is the ataxic cerebral palsy, which is the least common type. And ataxia means a lack of balance and coordination. It often presents as unsteady, shaky movements called tremors. And the fourth and last part is the mixed type cerebral palsy, which may involve a combination of the other types of cerebral palsy. So now for presentation, it can present as delayed motor milestones, particularly learning to sit, stand, and walk. It can also present as asymmetric movement patterns, for example, strong hand preference early in life. Also, abnormalities of muscle tone, particularly spasticity or hypotonia, and management problems, for example, severe feeding difficulties and unexplained irritability. Now, for the associated disorders, visual problems are associated in approximately 40% of CP patients. For example, strabismus, refractive errors, visual field defects, and cortical visual impairment. Hearing defects are also present in 3 to 10% of CP patients. Speech and language problems, epilepsy in approximately 50% of patients, and cognitive impairments, including intellectual disability, learning problems, and perceptual difficulties, which are common. Management involves a team approach. With health professionals and teachers, input from the family is important. Number 1, accurate diagnosis and genetic counseling. We should establish the cause of cerebral palsy if possible. If the cause is clear, then no further investigations. If the cause is not clear or unclear, we should do some investigations such as urine or plasma metabolic screen, consider congenital infections, chromosomal analysis, radiological investigations such as doing an MRI, looking for a vascular lesion malformation or a periventricular leukomalacia. The cause is clear. For example, I can give you an example such as a massive antepartum hemorrhage followed by a neonatal encephalopathy. So this is a clear cause for cerebral palsy. So that's when we don't need any more investigations. Number 2 is the management of the associated disabilities, health problems, and consequences of the motor disorders. The associated disabilities such as the hearing, visual, and epilepsy, cognitive, health problems should be monitored as well. Also, consequences of the motor disorder, such as drooling, incontinence, orthopedic problems. They might need surgery at some point. Also, the spasticity management, which aims to improve function, comfort, and care, and requires a team approach. Options include oral medications, for example, diazepam, dantrolene sodium, and baclofen. Inhibitory casts, for example, below-knee casts, increase joint range and facilitate improved quality of movement. Botulinum toxin A reduces localized spasticity. Also, intrathecal baclofen, which is suitable for a small number of children with severe spasticity and may enhance quality of life. Selective dorsal rhizotomy is a neurosurgical procedure whereby anterior spinal roots are sectioned to reduce spasticity. So number 3 is assessment of the child's capabilities and referral to appropriate services for the child and family. So here the most important thing is the role of the team. Assessment by a multidisciplinary team is essential. This team includes physiotherapists, occupational therapists, speech pathologists, orthotists, medical social workers, psychologists, special education teachers and nurses. Also, trends in service provision. Services are best provided with local communities. Therapists and special education teachers work with children at home and later in childcare centers, kindergartens, and schools. Working with families, also care of the child with cerebral palsy involve developing a trusting and cooperative relationship with parents. So number 4 is we'll address the common presentations to the emergency department. Respiratory problems, particularly pneumonia, uncontrolled seizures or status epilepticus. Also, they can present with unexplained irritability. Here we should consider acute infections, esophagitis, dental disease, hip subluxation, and pathological fracture. So that's it for this video. Thank you so much for watching. Please like, share, and subscribe. Thank you.